Functional needs population and emergency preparedness. General information on an education and rights for emergency preparedness. Oklahoma State Department of Health. The Oklahoma State Department of Health, OSDH, is an equal opportunity employer. This publication, printed by Emergency Preparedness and Response Services, was issued by the OSDH as authorized by Terry Klein, Ph.D., Secretary of Health and Commissioner of Health. 1,000 copies were printed in 2011 at a cost of $1.74 per compact disc. Overview. General information. Functional needs populations. What is emergency preparedness? Emergency grab-and-go bag kit. Family disaster plan. Shelter-in-place disaster plan. Overview continued. Family communication plan. The Americans with Disabilities Act, ADA, and emergency management. 7 basic principles of the Americans with Disabilities Act. Overview continued. Whole community concepts. Key concepts. People who have low vision or blindness. People who have developmental disabilities. People who are deaf or hard of hearing. People who have mobility disabilities. Families with young children. Senior persons. People who speak different languages. One size does not fit all. General information. Functional needs populations. Functional needs populations. We hear it all the time. Special needs and vulnerable. Both terms do damage. When people with disabilities are thought of as special, they are often thought of as marginal individuals who have needs, not rights. Quote by CTPNA. Functional needs populations. The word vulnerable has a similarly unfortunate effect. Vulnerable people must have things done for them. They're recipients, not participants. Quote by CTPNA. Functional needs populations. Definition. Children and adults with access and functional needs may have physical, sensory, mental health, cognitive, and/or intellectual disabilities affecting their ability to function independently without assistance. Functional needs populations. Definition. Others who may have access and functional needs include, but are not limited to, women in late stages of pregnancy, senior persons, individuals needing bariatric equipment or communications assistance. General information. What is emergency preparedness? What is emergency preparedness? Emergency preparedness is the preparation and planning necessary to effectively handle an emergency. It involves individuals developing an emergency plan that identifies services they require and resources they need to have on hand for emergencies. What is emergency preparedness? While each person's abilities and needs are unique, every individual can take steps to prepare for all kinds of emergencies, from fire and floods to potential terrorist attacks. General information. Emergency grab-and-go bag kit. Emergency grab-and-go bag kit. Think first about the basics for survival: food, water, clean air, and any life-sustaining items you require. Consider 2 kits. In one kit, put everything you will need to stay where you are. In another kit should be a lightweight, smaller version you can take with you if you have to leave your home. Emergency grab-and-go bag kit. Water. 1 gallon of water per person per day for at least 3 days for drinking water and sanitation. Food. At least a 3-day supply of non-perishable food and a can opener if the kit contains canned food. Emergency grab-and-go bag kit. Battery-powered or hand crank radio and a National Oceanic Atmospheric Administration weather radio, with tone alert and extra batteries for both. Flashlight and extra batteries or crank flashlight. First aid kit. Emergency grab-and-go bag kit. Whistle to signal for help. Dust mask to help filter contaminated air, and plastic sheeting and duct tape to shelter in place. Moist towelettes, garbage bags, and plastic ties for personal sanitation. Emergency grab-and-go bag kit. Wrench or pliers to turn off utilities, local maps, pet food, extra water, and supplies for your pet or service animal. Animal medication, crate, blanket, favorite toy, leash. Emergency grab-and-go bag kit. Extra sets of keys to your home and or vehicle. Important documents, medical records, medications list, Social Security documents, deeds, and trust, etc. Store in a convenient location for quick access. General information. Family disaster plan. Family disaster plan. The reality of a disaster situation is that you will likely not have access to everyday conveniences. To plan in advance, think through the details of your everyday life. Family disaster plan. Create a personal support network. If there are people who assist you on a daily basis, list who they are and how they will contact you in emergency. If you anticipate needing assistance during a disaster, make a list of family, friends, and others who will be part of your plan. Family disaster plan. Talk to these people and ask them how to be a part of your support network. Share each aspect of your emergency plan with everyone in your contact network. Include people outside your city in your support network. General information. Shelter-in-place disaster plan. Shelter-in-place disaster plan. If you are told to shelter in place, act quickly. Follow the instructions of the local authorities. In general, bring children and pets indoors immediately. If your children are at school, do not try to bring them home unless told to. The school will shelter them. Shelter-in-place disaster plan. 2. Close and lock all outside doors and windows. Locking will provide a tighter seal. 3. If you are told there is danger of explosion, close the window shades, blinds, or curtains. Shelter-in-place disaster plan. 4. Turn off the heating, ventilation, or air conditioning system. Turn off all fans, including bathroom fans operated by the light switch. 5. Close the fireplace or wood stove damper. Become familiar with proper operation of flues and dampers ahead of time. Shelter-in-place disaster plan. 6. Access to a water supply is desirable, as is a working hardwired telephone. Don't rely on cell phones because cellular telephone circuits may be overwhelmed or damaged during an emergency. Also, a power failure will render most cordless phones inoperable. Shelter-in-place disaster plan. 7. Take everyone, including pets, into an interior room with no or few windows and shut the door. Shelter-in-place disaster plan. 8. If you have pets, prepare a place for them to relieve themselves where you are taking shelter. Pets should not go outside during a chemical or radiation emergency because it is harmful to them and they may track contaminants into your home. Shelter-in-place disaster plan. The Humane Society of the United States at http://www.hsus.org suggest that you have plenty of plastic bags and newspapers, as well as containers and cleaning supplies to help with pet waste. Shelter-in-place disaster plan. 10. If you are instructed to seal the room, use duct tape and plastic sheeting, such as heavy-duty plastic garbage bags, to seal all cracks around the doors into the room. Tape plastic over any windows. Tape any vents and seal electrical outlets and other openings. As much as possible, reduce the flow of air into the room. Shelter-in-place disaster plan. 11. Make sure all family members know what to do in an emergency, whether they are at home, school, work, or outdoors. 12. This includes knowing the telephone number of an out-of-town friend or relative who has agreed to serve as an emergency contact. Shelter-in-place disaster plan. 13. It can be easier to reach someone out of town during an emergency than to reach someone locally, including family members. 14. The contact can collect the information on where and how everybody is and help reassure and reunite families. Shelter-in-place disaster plan. 15. Call your emergency contacts and keep the phone handy in case you need to report a life-threatening condition. Otherwise, stay off the telephone so that the lines may be available for use by emergency responders. Shelter-in-place disaster plan. 16. Keep listening to the radio or television until you are told all is safe, or you are told to evacuate. Do not evacuate unless instructed to do so. Shelter-in-place disaster plan. 17. When you are told that the emergency is over, open windows and doors, turn on ventilation systems, and go outside until the building's air has been exchanged with clean air. General information. Family communication plan. Family communication plan. You may not be together when disaster strikes, so plan on how you will contact one another and review what you will do in different situations. Consider a plan where each family member calls or emails the same friend or relative in the event of an emergency. Family communication plan. It may be easier to make a long-distance phone call than to call across town. An out-of-town contact away from the impacted area may be in a better position to communicate among separated family members. General information. The Americans with Disabilities Act and Emergency Management. The ADA and Emergency Management. The Americans with Disabilities Act, ADA, Prohibition of Discrimination. Discrimination is illegal. The ADA and Emergency Management. Denial of participation is illegal. You cannot be denied participation in activities in a public facility. General information. 7 basic principles of the Americans with Disabilities Act. 7 basic principles of the Americans with Disabilities Act. Inclusion, integration, equal access, self-determination, physical access, reasonable modifications to policies, practices, and procedures, effective communication. 7 basic principles of the Americans with Disabilities Act. Examples. You cannot be moved to a long-term care facility without your consent. You should have all emergency information in an accessible format. 7 basic principles of the Americans with Disabilities Act. You can ask for a language interpreter when you do not speak English or if you use American Sign Language, ASL. 7 basic principles of the Americans with Disabilities Act. Examples. A service animal is allowed into emergency shelters. The emergency personnel can only ask you 2 questions about your service animal. 1. Is this animal needed because of a disability? 2. What task or work has the animal been trained to perform? Whole community concepts. 2 key concepts. 2 key concepts. Concepts. 1. Ensuring that our response and recovery actions are driven by the actual needs of the entire affected community and the conditions on the ground, including the population, demographics, and geographic location. 2 key concepts. 2 is the concept of ensuring that the state and local emergency management teams and other agencies plan for the entire community in their all hazards plans. Functional needs populations should be included in all plans. Whole community concepts. People who have low vision or blindness. People who have low vision or blindness. Please refer to the general information of the presentation along with this specific information for people who have low vision or blindness. People of low vision or blindness. Mark your utility shutoff valves at home with fluorescent tape, tactile glue, large print, or braille labels. Practice the exits that you will use during emergencies. People who have low vision or blindness. Place security lights along the path for exit identification. These lights plug into wall outlets and light automatically if there is a loss of power. People who have low vision or blindness. Flashlight and plastic emergency whistle. Even among people with visual disabilities or people who have low vision, having a flashlight is very important for emergency preparedness. A whistle can provide another audio clue for emergency location during the disaster. Glow sticks can also be used for location assistance during emergencies. People who have low vision or blindness. Plan what you will do if your service animal becomes confused, frightened, or disoriented. Ensure there are other ways you can exit your home if the service animal cannot assist you during emergencies. People who have low vision or blindness. Assistive devices. Make sure you pack these items into your grab-and-go bag kit or use them when you leave your home. People who have low vision or blindness. Cane, even if you have usable vision or is a guide dog user, a cane can be essential for mobility to help maneuver around obstacles, identify barriers, and negotiate around other potential obstacles in the shelter or your home. People who have low vision or blindness. Work gloves and sturdy shoes. After auditory cues, touch is the most heavily relied upon sense for someone who has a visual disability. A pair of heavy work gloves and sturdy shoes can offer safety and security in exploring an unfamiliar environment while residing in the home or shelter. People who have low vision or blindness. Fire safety is very important. The only thing you cannot do is see clearly. You are capable of hearing an audible smoke alarm. You are capable of crawling low on the floor to escape fire and go to a safe place. People who have low vision or blindness. Learn how to use a fire extinguisher. Install smoke alarms. Service animal. A service animal is allowed into emergency shelters. The emergency personnel can only ask you 2 questions about your service animal. 1, is this animal needed because of a disability? 2, what task or work has the animal been trained to perform? Whole community concepts. People who have developmental disabilities. Whose responsibility is it? People who have developmental disabilities. Please refer to the general information of the presentation along with this specific information for people who have developmental disabilities. People who have developmental disabilities. Planning process. The individual with the disability should lead this process. Parentheses, person-centered. Family, guardians, and paid caregiving staff must be included in the planning process, but it is your individual plan. People who have developmental disabilities. If you are employed, ask to see your employer's emergency plan. Work with them if necessary to ensure people with disabilities are included in the plan. People who have developmental disabilities. Have necessary equipment, supplies, operational manuals, equipment warranties, spare equipment parts, and tools in one easy-to-locate place. People who have developmental disabilities. Create your specific emergency plan. Be sure to include routes of exit from home or place of employment. People who have developmental disabilities. Planning process continued. Teach those who may need to assist you in an emergency situation what the equipment is and how to properly operate it. People who have developmental disabilities. Planning process continued. Plan for transportation in the event of evacuation. Add items specific for your personal and health needs in your emergency go bag kit. Practice the plan. People who have developmental disabilities. Tips for your emergency grab and go bag kit. Tip number 1. If your wheelchair tires are the type that require air, include a can of Fix-A-Flat in your emergency grab and go bag kit. People who have developmental disabilities. Tips for your emergency grab and go bag kit. Tip number 2. A wheeled suitcase makes an easy to grab and go bag to store your emergency supplies. Whole community concepts. People who are deaf or hard of hearing. People who are deaf or hard of hearing. Please refer to the general information of the presentation along with this specific information for people who are deaf or hard of hearing. People who are deaf or hard of hearing. Perform a self-assessment. What are the personal abilities and limitations that may affect your response to a disaster? Do you live alone? Do you drive and own a car? People who are deaf or hard of hearing. Plan for your service animals or pets. Service animals are allowed in shelters. Non-service animals / pets will receive services in a separate facility close by the shelter. Pets are not allowed into the shelter. People who are deaf or hard of hearing. What are your communication preferences? Do you use American Sign Language, ASL? Do you lip read? Do you need an interpreter? People who are deaf or hard of hearing. What are your communication preferences? Do you communicate verbally? Do you have any residual hearing? Are you able to hear on a telephone? People who are deaf or hard of hearing. National Oceanic Atmospheric Administration, parentheses, NOAA, Weather and All Hazards Alert Radio. These special radios provide one of the earliest warnings of weather and other emergencies and are programmed to alert you to hazards in specific areas. Many models come with strobe attachments and limited text screen displays. People who are deaf or hard of hearing. Internet sites. There are websites that provide you with breaking emergency alerts. However, care should be taken to not use a computer during an electrical storm. Also consider how you would access the internet if phone lines are down and power is out. People who are deaf or hard of hearing. Visual and vibrating alerting devices. Examine all of your visual and vibrating alerting devices, parentheses, e.g. alarms, telephone, and doorbell. Determine whether they are battery operated or have battery backup. People who are deaf or hard of hearing. Visual and vibrating alerting devices. In the event of a power outage, these devices may not operate. Change the batteries in these devices every 6 months. People who are deaf or hard of hearing. Hearing aids. Consider storing your hearing aids in a container by your bedside, which is attached to your nightstand using Velcro. Some disasters, e.g. earthquakes, may shift items that are not secured, making them difficult to find quickly. People who are deaf or hard of hearing. Key phrases card. You may want to carry pre-printed cards that have key phrases. This may help you communicate with firefighters and other emergency personnel. People who are deaf or hard of hearing. Some phrases that may be useful are: John uses American Sign Language, ASL, and need an interpreter. Mary needs announcements, written or signed. Morgan cannot hear sirens or alarms. Whole community concepts. People who have mobility disabilities. People who have mobility disabilities. Please refer to the general information of the presentation along with this specific information for people who have mobility disabilities. People who have mobility disabilities. Start the planning process. The individual with the disability should lead this process. Person-centered planning. Family, guardians, and paid caregiving staff must be included in the planning process, but it is your individual plan. People who have mobility disabilities. Planning process continued. Create your specific emergency plan. Be sure to include routes of exit from your home or place of employment. People who have mobility disabilities. Planning process continued. If you are employed, ask to see your employer's emergency plan. Work with them if necessary to ensure people with disabilities are included in the plan. People who have mobility disabilities. Planning process continued. Update the plan as situations or health changes. Have a backup plan and teach those who may need to assist you in an emergency situation what the equipment is and how to operate it. People who have mobility disabilities. Planning process continued. Plan for transportation that can accommodate your mobility needs during evacuation. Practice the plan. People who have mobility disabilities. Other items in your emergency grab and go bag kit. Have necessary equipment, supplies, operational manuals, equipment warranties, spare equipment parts, batteries, and tools for any assisted devices in the emergency supply kit. People who have mobility disabilities. Important documents. All Medicaid, Medicare, insurance documents pertaining to any equipment purchased by these funds. People who have mobility disabilities. Tips for your grab and go bag kit. Tip number 1. If your wheelchair tires are the type that require air, include a can of Fix-A-Flat in the supply kit. People who have mobility disabilities. Tips for your grab and go bag kit. Tip number 2. Include a can of tennis balls in case of damage to the tips on canes, quad canes, collapsible canes, or walkers. People who have mobility disabilities. Tips for your grab-and-go bag kit. Tip number 3. A wheeled suitcase makes an easy-to grab-and-go bag for your emergency supply kit. Whole community concepts. Families with young children. Families with young children. Please refer to the general information of the presentation along with this specific information for families with young children. Families with young children. Families with children, as well as pregnant and breastfeeding mothers, present unique needs that families should consider when preparing for a disaster. Families with young children. Make the following a priority in the grab-and-go bag kit when you have an infant. A picture of you and your children, formula and bottled water to last several days, 2 to 3 washable bottles, baby food or cereal with utensils. Families with young children. Continued. Plenty of diapers and wipes, blankets and changes of clothes, soap, shampoo, and laundry detergent specific for a baby. Families with young children. Continued. Routine medications and medications for fever or physical discomfort. Extra comfort items such as a blanket, pacifier, etc. Pediatrician's phone number and insurance card. Families with young children. Breastfeeding mothers should have enough water for 100 ounces of water per day, or approximately 13 cups. High-protein snacks including nuts, cheese, beans, or peanut butter. Nursing pads and other needed undergarments. Families with young children. Breastfeeding mothers should have manual breast pump, bottles for breast milk storage and cold storage, washable bottle to feed breast milk or for alternative feeding if needed. Families with young children. Breastfeeding mothers should have antifungal topical cream for potential infection, clothing appropriate for breastfeeding, obstetrician and family physician phone number in case of problems. Families with young children. Expectant mom's preparation. Stress can result in preterm labor and increase in contractions. Expectant moms are encouraged to prepare with items that promote relaxation, such as additional pillows, heat packs, or iPod with relaxing music. Families with young children. Expectant mom's preparation. Adequate bottled water for increased fluid requirements of pregnancy. High-protein snacks to maintain energy. Obstetrician's telephone number. Families with young children. Expectant mom's preparation. Comfortable shoes, items for relaxation, insurance card. Families with young children. Expectant mom's preparation. Prenatal vitamins and routine medications. Information on the nearest hospital, instructions from the doctor in case of emergency, copy of recent medical records. Whole community concepts. Senior persons. Senior persons. Please refer to the general information of the presentation along with this specific information for senior persons. Senior persons. Electronic payments for federal recipients. Keep in mind a disaster can disrupt mail service for several days or even weeks. The electronic payments will ensure a person's money will be available for their usage. Keep cash in the event that the ATM machines do not work. Senior persons. Create a support network. If you anticipate needing assistance during a disaster, talk to family, friends, and others who will be part of your personal support network. Write down and share each aspect of your emergency plan with everyone in your support network. Senior persons. Create a support network continued. Make sure everyone knows your plan to evacuate your home or workplace and where you will go in case of a disaster. Make sure that someone in your local network has an extra key to your home and knows where you keep your emergency supplies. Senior persons. Teach those who may provide assistance to you how to use any life-saving equipment or administer medicine in case of an emergency. Practice the plan with those who have agreed to be a part of your network. Senior persons. Additional supplies and documents. If you take medicine or require special medical treatment on a daily basis, be sure you have what you need to make it on your own for at least 72 hours, 3 days, maybe longer. Senior persons. Additional supplies and documents. Make a list of prescription medicines, including dosage, frequency, treatment, and allergy information. Senior persons. Work with your providers to identify backup services and incorporate them into your personal support network. Consider other personal needs such as eyeglasses, hearing aids, batteries, and oxygen. Senior persons. Emergency documents. Include copies of important documents in the emergency supply kits such as family records, medical records, wills, deeds, Social Security documents, credit cards, and bank account information as well as tax records. Senior persons. Emergency documents. Have copies of medical insurance and Medicare cards readily available. Senior persons. Emergency documents. Keep a list of the model and serial number of medical devices or other life-sustaining devices. Include operating information and instructions. Senior persons. Emergency documents. Make sure that a friend or family member has copies of these documents. Include the names and contact information of the support network as well as the medical provider. Senior persons. Emergency documents. If you have a communication disability, make sure the emergency information notes the best way to communicate with you. Keep these documents in a waterproof container for quick and easy access. Whole community concepts. People who speak different languages. Languages besides English. People who speak different languages. All emergency information should be provided in a format that you can understand. Ask for a specific language interpreter for correct communication translation. One size does not fit all. One size does not fit all. All individual needs should be addressed in your local community's emergency plans. Everyone should have their own disaster plan. Everyone has different needs in emergency preparedness. Summary. Summary. General information. Functional needs populations. What is emergency preparedness? Emergency grab-and-go bag kit, family disaster plan, shelter-in-place disaster plan. Summary. General information. Family communication plan, the Americans with Disabilities Act, ADA, and emergency management. 7 basic principles of the Americans with Disabilities Act, ADA. Summary. Whole community concept. Key concepts. People who have low vision or blindness. People who have developmental disabilities. People who are deaf or hard of hearing. People who have mobility disabilities. Family with young children. Senior persons. People who speak different languages. One size does not fit all. References. www.ada.gov, www.cdc.gov, www.fema.gov, www.ready.gov, www.rochesterredcross.org. Contact information. Glenda Ford Lee, MHR, Oklahoma State Department of Health, Statewide At-Risk Populations Coordinator. Office number 405-271-9444, extension 56426. Fax number 405-271-5143. Email glendafl@health.ok.gov. Elizabeth Baldwin, BSN, RN, OKC-County Health Department, Emergency Response Program. Office number 405-419-4231. Email elizabeth_baldwin@occhd.org. Contact information. Meredith Maynard, BSN RN, Tulsa Health Department, Mass Care Coordinator, Emergency Preparedness and Response Program, office number 918-595-4082, fax number 918-595-4588. Web address www.tulsa-health.org. Email mmayynard@tulsa-health.org. Rick Barkus, Oklahoma Developmental Disabilities Council, Director of Planning and Grants Management, office number 405-521-4965. Email address rick.barcus@okdhs.gov. Contact information: Vicki Golightly, Library for the Blind and Physically Handicapped, Public Information Officer, office number 405-521-3514. Email address vgolichtly@okdrs.gov. American Sign Language Interpretations, OSU-Oklahoma City Interpreter Training Program, Aileen White, Adjunct Instructor, Gary Davis, Assistant Professor, Whittle Jackson, Student, Christine McDonald, Lab Technician. For contact information, email itp@osu.okc.edu. English Interpretations, Bradley Casper, BBA, COI, Continuity of Operations Executive Coordinator, Emergency Preparedness and Response Service, Oklahoma State Department of Health. Phone 405-271-9444, extension 56156. BlackBerry 405-568-9608. Fax number 405-271-5143. Email address bradleyc@health.ok.gov. Spanish Interpretations, Jose Munoz and Maria C. Arroyo, Oklahoma State Department of Health, Interpreter/Translator, Office of Minority Health. Office number 405-271-1337, fax number 405-271-9228. Email address josem@health.ok.gov and mariaar@health.ok.gov.